Zice, unul, doi, sau de fără băzeală, vedeți, dar putem începe, Costel? Putem începe? Costel, am să deschid eu. Așa? Da. Good morning. We are still timely, although 5 minutes delay. We start a new session, and I'm absolutely honored to be among the chairmen, together with Professor Vlad Ciurea and Professor Carbajo and Professor Carpentier. And let me introduce the first work presented by Professor Alexandru Vlad Ciurea with some fellows. State-of-the-art in lumbar disc hernia, general data, neuroimaging, operatory indication, result, neurorehabilitation, complications, outcome, and medical legal aspects. Please proceed, Professor.
Pleasure to be here and disc hernia. It's working. Every day we are in front of this pathology. All the specialties, not neurosurgeons, neurologists, balneologists. What is good in that situation? What to do in that situation when you operate? I want to tell you a very important secret, but it's totally confidentially in the technical area. Many surgeons operated without any logistic ideas. Because they are young, they want to perform, they want to have a palmarès in surgery and appears, excuse me, malpractice, many wrong activities. Many. Excuse here in the area of Constanța, there is a surgeon who operated and we receive, I don't want to say the name, we receive many complications in Bucharest because appears in the papers officially. Because he exaggerated the indication of OPE. It's necessary to have a limit what we are doing for this lumbar disc hernia. And another secret, I tell you only in this 47 Congress, if you do surgery for microsurgery for lumbar disc hernia, do one step in one way, not many others OPE. One is necessary and remain with have time not to be in hurry and know exactly the patient and exactly what's happened after OP. And after OP in front of this you are Gelo Onose and you and Mrs. Where is Mrs. UNESCO and you are in front. Because continue to do rehabilitation and introduce the patient in activity. There are many of the patients are young today. Many complain from low back pain, and many necessary to have a continuous and not remain at holidays, continuous activity. This is an introduction. Here is my paper. maybe, if you say. It's state of art in lumbar disc hernia about everything, general data and neuroimaging, operatory indication, results, and so on, and complication and outcome, and very, very problem about medical legal aspect. But it's possible to stop the light in this part. Merci, madame. As these are my title, I work from 12 years in the private hospital in Centrum of Bucharest, but I collaborated with Gelo Nose. We are co-authors. Is a treatise of neurosurgical treatise. One part of neurosurgical treatise, the rehabilitation. It's our ideas, is our collaboration for many times. This my collaborators of this paper. I'm not alone. I collaborate for this. It's a beautiful country, which is Romania. It's Bucharest, and this littoral, a beautiful littoral. It's our job, our aim to rise, to know, all the people know about this Romanian littoral and this beautiful area, which we name as a jewelry. We name as the name of this state, 70% of population have an episode, a low back pain over the lifetime. All of us, we have this. What we are doing, not all these are surgery. May see what is low back pain. Is cancer is possible. Spinal osteomyelitis is possible. Compression, fracture, spinal stenosis, listhesis, and so on, and spondylolysis, and lumbar disc hernia. There are many causes of this. This is clearly herniated nucleus pulposus, and is a lumbar disc hernia. But there are the others, benign hemangioblastomas. And here, osteomyelitis, clear. And this tumor infiltrated lumbar vertebral bodies is here, is my case of this. Another case, prostate carcinoma, was a writer from Braila. The name of this lumbar carcinoma, Dr. Gelonos and myself, we have seen this case in Elias many years ago. There is a causes of lumbar disc hernia. Not all the cases are the confront of this diagnosis or the other pathologies. In front of lumbar disc hernia, there are many questions. What is a hernia? Is not hernia? Is necessary OP or not OP? Is necessary a conservative treatment? First, conservative treatment. Second is surgery, not in front. Only 3 indications are for surgery. And what kind of surgery we are doing in the lumbar disc hernia? Here is a nucleus pulposus, is herniation. Am să fac o confidențială în limba română. Știți ce înseamnă herniere? Herniere când domnii pleacă de acasă după țigări și se uită să mai întoarcă. A ieșit afară. Herniation, yes. Here is the stage. There are 4 stages in herniation: cervical and lumbar stage of herniation. And important for surgeries are the 3rd level and the 4th level, not in the 1st and 2nd levels in lumbar disc hernia. Here is a special. We said this herniation appears in axilla. Nicio problemă. Nu fiți supărați. Stresul nu duce la nimic bun decât la guvern. Care este asemănarea între Congresul 47 și Parlament? Că domnul ăsta e stresat. Nu mai fiți stresat. Everything is okay. We discuss about the stress. No? Doesn't matter, doamnă. Doamnă, lăsați-l, vă rog. Yes. In all the cases, this herniation appears, we said, in surgery, in axillar part of the part about the root and the dural activity in this part. In this appears the herniation. And 3 lumbar disc hernia are emergency, where hyperalgesia, increased motor deficit, and the 3rd caudal echina syndrome. One of our president has this caudal echina syndrome and was an emergency, a real emergency. And He decided to go outside, but it's not my job for this. And the clinical stages of lumbar disc hernia is lumbar disc hernia. And the third stage and the fourth stage are indication for OP, not in others. Irritative, nothing is for you, not for us. We introduce in the compressive, in the motor deficit, neurological deficit, not before. It's very interesting. In 1957, Sese describes this classification. It's very clear and remain. My professor, which is a monument in neurosurgery, every case discuss about of this. What is the classification of Sese and what kind is lumbar disc hernia? It's a cause of hyperalgesia. It's a motor deficit. Please tell the indication exactly. And Sese is very clear. It's from France, monsieur. And in my study, personal study, my personal activity in lumbar disc hernia, 8,148 consecutive patients operating the same procedure. The procedure was microdiscectomy. I learned this microdiscectomy in Germany, in Bonn, in Würzburg, and after that in Karlsruhe, and they taught me about this and said, and after that in Berlin, was a professor said, this is the future in micro with microscope and discectomy very, very slowly. Immediately, I show you exactly what's happened. For you, these are the patients in our experience with low back pain and leg pain, and another patients with neurological deficit and local paresthesia. Local paresthesia is very important. It's a sign. It's a neurological sign. And in our experience, lumbar disc pathology hernia, L5, S1, more than 56%. What we are doing in the OP removal, the herniating disc, neurological activity decompression, discectomy, yes, very, very slowly reduce the pressure and prevention the recurrences. It's very important to have this. This is a patient with LASIK sign, very, very clear about this and what we realize about our surgery. And it's very important to have very slowly, and after this there are some special maneuvers not to have any infection in the disc after OP. Neuroimaging is perfectly is necessary, but my job is to say to young doctors, be carefully, do all, not to have only one. It's impossible to operate by only CAT scan. Operated by CAT scan, radiography, and MRI if it is necessary. But it's necessary to know exactly what's happened. And from comparative CAT scan, only to know exactly the lumbar column in 3D, I said, native in 3D CAT scan, and MRI is very important. One case, please see, a lumbar disc hernia, L2, L3, another, a giant median lumbar disc hernia, and another with giant with fragments, compressive fragments with neurological deficit, stenosis here, and all are indication sure not to postpone the indication. And multi-level lumbar disc hernia in 2 levels is necessary in 1 step to have time enough not to be in hurry. And operatory management, in my opinion, in this moment remain microdiscectomy, but for the future appears microdecompressive by endoscopic procedures. We are better probably for the future, and we will introduce slowly this kind of OP. This is, we said, Mahomedan. Is the same who you stay in front of a lady. Yes, and C-arm is mandatory in OP room to have a perfect OP. This is our OP. It's real. It's a photo in Sanador Hospital. It's our microscope, our Kinevo, and this is OP. The photo for our OP theater, and this is one lumbar disc hernia, 36 years, a young patient. It's what I said slowly, not to be in hurry, to dissect exactly, not have any, it's impossible to use blood transfusion in this kind of OP. It's not necessary. It's necessary only to have time. not to be any other, not call, no TV, no TikTok and government problems. Yes, slowly, and this is a dissection, micro discectomy is dissection to have perfectly, to know exactly where is the disc and to enter in the disc exactly and open and disc and removal very, very slowly. Yes. Yeah, this is a reality. All the OP which are in hurry, they are bad, which please see here. Very clear and not any blood. And the disc was opened. It's herniation. You have seen the protrusion? After that, the dissection around and around. And after that, after introduce the instrument which we take out, the disc which are modification of the disc, and decompress the one surgeon, very young, discuss with chief. Chief, the disc is very strong. Yes, sure, is very strong. And it's impossible to take it out. Sure, because the disc was for the health person. Please see, the disc is ill. It's a modification. And for that, it's possible to take out the disc with modification, and the whole procedure with microscope is the name, not with the loops, because all the surgeons and the others to be around to see exactly what happens, and important, the anesthesiologist to know exactly what we are doing, because anesthesiologist collaborated with us, not to stay outside and discuss. Please see with the lady what's happened about football and other things. This is a lumbar disc hernia. Yes, and now we took out everything. It's a collaboration to realize the hemostatic procedure and to close. It's the move was this gentleman, 33 years old, one surgery. He has 56 years old and in the good situation. It's a lady, it's a lumbar dystonia, and many other cases. But after surgery, immediately, when the patient are in good condition, in the same department of neurosurgery, to start about what we are doing, neurorehabilitation here. And the physical neurorehabilitation, there are many centers in Bucharest. It's very famous in here in Tekergol and sure in the Felix area, and many others. And I congratulate you for these activities, nucleoplasty and laser. Many times we try this in Bucharest with bad results about this and enter in the disc and to reduce the bulging of herniated, not in exactly lumbar dystonia, was in stage 2 irritative and bulging disc. Not good results. Other was laser, was total abandoned this situation about the laser. And remain for the future, sure, maybe. Mă ajutați? Probably here. Yeah, it's okay. Endoscopic procedures with minimal invasive. It's minimal invasive, yeah. For the ladies, for the gentlemen, the same. What do you say in Romania? And the first body guy, yes, and and here it's advantages. Yes, it's minimal invasive surgery, spinal surgery, minimal with radical discectomy. It's impossible with this procedure, but for the future, sure, the progress are very important, and sure we have good results in that situation. In Universitary Town in Iași, they presented cohort 32 cases about this minimal invasive spinal surgery in lumbar disc hernia. From 32, there are 3 cases of CSF fistula, and they stopped for that because they didn't perfectly see what's happened in the area of lumbar disc area. insertion of cannula and exactly laminotomy, identification the disc and the nerve root. This is very important. After that, to take out very slowly to take out the hernia. It's difficult, many hours, but it's necessary to know exactly this minimal invasive procedure, and probably for the future, this will be our aim for the future. The case was some colleagues give me from Yashi, and was really probably a real progress in neurosurgery. Complication. Generally, surgeons didn't want to speak about about their complication. 10% of complication. Dural compromise important, in discitis are important. There are many complications in lumbar disc. Not too much, but to be carefully for everything. There are literature cases incredible about discitis with very difficult cases, because it's very difficult to treat the lumbar disc discitis. About one problem in the literature appears by malpractice, and many surgeons, many neurosurgeons are confronted of the malpractice in neurosurgery, and especially in lumbar disc hernia. We enter in this part of literature. It's a problem for neurosurgery, because spinal neurosurgery are many problems about malpractice. And in our country is the same. Many causes, many files, many problems are the Collegio Medici, you know. And also lumbar disc hernia is a problem, it's a general problem for the society. And because appears economical problems in the literature data. You know exactly, there are active population and stay out, it's impossible to work because you low back pain. Comparative epidemiology malpractice claim, and every year increase the spinal surgery 56% in the literature, 39 for the brain. In neurosurgery remains lumbar disc hernia, spine surgery remains a problem. Causes of litigation: one, poor communication, totally. The doctors are very hurry, I cut you, I treat, yes. I treat hernia, go, nothing to do. What is this? Not the medicine. Misdiagnosis, wrong indication, unindicated surgery, unindicated, be careful. Poor investigation is necessary, have a total armamentarium of investigation. Inappropriate preoperative patient assessment is very important, and probably here, and special for elderly patients who are multiple pathology with hypertension, diabetes, osteoporosis, and appears a lumbar disc stenosis or hernia. And this is what you are doing, because appears many complications. And stressful situation about malpractice, what to do in front of malpractice, to see exactly in front of the patient in his eyes and say what to do. Because if you are going home and not to reply, it's very dangerous. As a litigation, a stressful event for the physician, for surgeon not to be in stress, because it's necessary to continue the activity. And for that, avoid medical malpractice stress totally, and have many discussion and communication, good communication, and visit the patient. And the comportment is friendly, like a friend, not like an enemy, with OP patient and that kind of surgery. And always remember, this is especially for surgeons, not for balneologists or what we are doing recuperation. Nobody is immune for medical malpractice. Nobody. Nicht Johannes. And temperate young surgeons, enthusiasts, they are in very great enthusiasm. It's not to operate in a hurry. For that, it's very important to see the case imperfectly. Knowledge is power. It's very important, this knowledge, the support of this knowledge to know exactly what's happened. Think always to do it right for the first time. First time is important. The gentleman who I presented is 30 years after his OP is a perfect condition, is a president of firm of building in Bucharest. This is a perfect neurosurgical outcome everywhere in the world, and president receives this kind of surgery. Thank you very much in beautiful town.
Very much. Let me ask Professor Carpentier to take the leadership and announce the next work presented by Professor Carbajo, because we are here all fellows in the chairmanship.
So the next presentation will be given by Professor Carbajo, together with Francisco Armillo, Maria Lorena Vela, José Antonio de Gracia, and Francisco Maraver. And this is about the peloids, new contributions.
An honor. It's an honor for the Romanian people. It's an honor for us too, the Spanish people. We speak about Peloid's new contribution. We all know the official definition of Peloid, make it in the conference on the ISMH in Dax in France in 1949. All the people know it. And we know it, the different variants of depending on its composition, depending on the origin of the water, depending on the type of water, depending on the temperature we make it, the maturation, and depending the kind of maturation we can do it. We manufacture a product with three essential elements: a solid support, generally not pure, that is very important, mineral water, and microbial content to improve its cosmetics and therapeutic properties. Then Seki said yesterday, hydrobiota, which allow us to prepare different products with medical at the right and cosmetic properties at the left. From a purely chemical point of view, okay, purely chemical point of view, we like to classify peloids in three categories: clays peloid, organic peloids, and hypersaline peloid, with the reflection that it is practically impossible to find a pure peloid. We have usually combination of the different kind of peloid. During peloid preparation and maturation, a microfactory is generated inside it. That alters its composition and characteristics. During changes in all the area, the maturation changes all the area, physicochemical, biological, even its properties are altered by maturation. Thermal maturation can be controlled because you have to improve the properties of the pelloid or making a garbage because it's a natural process. And you need to describe it, the ideal time to maturation. And I have an example here. In this pelloid, the endpoint is the quantity of fatty acid. This example determines optimal maturation time through fatty acid. I repeat it. Optimal fatty acid concentration we made at 6 months. We have here. We have here in the red column at 6 months. We have in the beginning 5 months. We in blue column we have a few quantity of fatty acid. At 6 months we have the more quantity, and in 7 months decrease, which decrease after 7 months. The green color progresses losing properties. But this question is very important to control the time of maturation. You have a Gauss curve, and you have sometimes different concentration of active depending on the time. And we need for this question to control it. In more of the maturation usually occur in anaerobic environment and originate with the presence of transformation of organic matter and the formation of humus. Humus is mainly made up of fulvic acid and humic acid. Here, the composition of the humus fulvic acid, to which bacteriologically binds protein and carbohydrate that lead the formation of humic acid with great anchoring and attraction capacity for different molecules and water. We have here the red spots and the blue spots are when the water and the salt go to this area. The humic acid is solved with water and its salt through the numerous linking, like carboxyl group, phenolic hydroxyl group, alcoholic hydroxyl group, etc. The usual, we are speaking about clayly pelloid. The usual structure of pelloid is provided by the clayly compound. In these images, we have a monouranide. It's a clay with 2-1 structure, 2 tetrahedral structure, and 1 octahedral, and repeated on all the molecules. In this structure, there is an anaerobic solvation zone, this area, where the microfactory of the pelloid can be located. We recall that solvation is the ability of salt to absorb water. And we have different kind, we can appreciate the anaerobic layer of the solvation of the clay on the right and compare with a non-clay structure such as the talc on the left. We can see perfectly here the solvation area, and that's a different with the other composition. Which have the talc have no solvation layer and is not able to absorb a large amount of water, and consequently has difficult to make humus. Clay has numerous interlaminar ion exchange to facilitate water absorption with B. The phenomenon occurs in the anaerobic solvation areas. We can put it water absorption with B inside the clay. The clay in this hole, we located the pelloid anaerobic microfactory, but also allow the deformation of the clay and to adapt to the surface of the body. Furthermore, as well we see later, it is the plate where some different types of glycolipids with anti-inflammatory properties are developed during maturation. Furthermore, hydrogen bond formation also facilitates the absorption with D in the surface of the water and is the anaerobic surface area of the clay. And another linking, likewise, the surface breakage of hydroxyl group and the consequent attraction from cations produce a surface absorption with the of water. The humus adhere to the clay with a multiple kind of links. The organic humidification that produced here process is the transformation of the different soil material to the bacterial biomass into benzene aromatic molecules, like here, with emulsifying properties and activation properties and promoters of skin absorption. We can found too with the organic humidification aliphatic chains like paraffins that provide to the pelloid its cremosity and alcoholic waxes that provide hardness to the pelloid mass. And finally, vegetal melanine that provide the black color to the meat, like here. Sulfur are generated in anaerobic environment in the deep layer of the soil without oxygen and without light. Sulfate and organic matter are transformed by sulfate reduction bacteria into hydrogen sulfide inside the mud. In anaerobic areas close to the surface and poorly illuminated, is converted in sulfur by photoautotrophic bacteria. And finally, in the aerobic surface layer, the sulfur and hydrogen sulfide generated are oxidated to sulfide and restarting the cycle of sulfur. But in the nature, we have the same question. In anaerobic circumstances, inside in the soil in the lake, for example, we have sulfate that reducing bacteria convert to an hydrogen sulfide that with the presence of the oxygen is transformed to sulfate, and sulfate begin again the cycle of sulfur. You remember that last slide. It's very known for you. Yesterday, my angel, I don't see here, Simona, showed us, the Professor Maravera and me, Floyd. It's black. It has a melanin. It has an organic process. And you can hear the conversation because it's a video. We made the video yesterday. And we are speaking about, and I said in Spanish, smell a lot and hydrogen sulfide when I move with it. And that's right. And the two processes that I described in the two last slides is the phenomenon we have here. For us, for chemical point of view, it's not important the name, sapropelli, mud, but But the real situation is that we have an organic and a sulfur and hydrogen sulfide alloy. The other one classification is hypersaline alloy. We speak about this question, this topic yesterday. I remember we need a special situation on the climate condition and there, and to make an ordinary precipitation of different compounds that the water have to make the pelloid. But they need a special condition. You remember, the layer of water is very little. It's impossible to make pink lagoon if you don't have little. You can see perfectly in Canary Island. This is La Palma Island from the Canary Islands. Is the paradise, and you have here the lakes from to contain salt, and you have the different pink color is due to the phenomenon of evaporate that I explained yesterday. Again, the pelloids have different properties in the actuality, and there is many use for clays and pelloids. It's used in preparation of gel, patch, emulsions, bound, care, as antimicrobial. And we see more and more publication about clays and drug carriers. Here we have the comparison of the number of the proportion of the scientific publication. A lot of work is being done with white-green clay. Here we have it. With white clay, green clay, and sepiolite is non-polar absorbent clay, and a synthetic tubular clay. Its name is algiosity, who has the property to transport the active inside the skin. The composition of the pelloid is vital. It's impossible to describe all the properties here. In the ingredients that form a pelloid are vital in their activity. In this presentation, we are only going to study the general properties of most of the pelloid, regardless of the main asset. Regardless of the main asset. I wanted to first present a review carried out by the Romanian group or host on pellet therapy and rehabilitation. From here, our congratulations to Constantin, Mariana, Gabriela, Elena, Valentina, Vlad, and Jelu for your magnificent work. The first is considered that the therapeutic power of pelloids is due to the thermal conductivity that I described in 2018, Gomez et al. From our friend from Portugal. One pelloid around 40 degrees can act as sedative and analgesic, helping to reduce the muscle spasms and increase the pain suffered. Many clays used in pellet therapy as sepiolite have a high oil absorption capacity. This phenomenon helps to eliminate the toxin, bacteria, and dirt from the skin, reducing the bacterial load through the production of reactive species through the Fenton reaction. And finally, the metal chains can exert the properties, the pelloid. Clays, in general, and fibrous one is in particular is high porosity, and the presence of many sinyl groups stimulate absorption and elimination of the exudate, and can significantly absorb bacteria and toxins. It can facilitate the reconstruction of skin epidermal barrier during the health process, and they can contribute to angiogenesis involved in the regrowth of the skin. Spa therapy is helpful in stress, improving its resilience with and without more treatment. Patients with arthritis, as Antonella Fioravanti, we said for there, said and know perfectly, when they are treated with peloid, showed higher levels of serotonin and lower level of dopamine, and that is good. And metal ion release from peloid to the ion exchange can improve the activity of some skin enzymes, such as glutathione and superoxide dismutase. We can repair cells and reduce the damage caused by the superoxide radical, then also to promote the skin absorption. Glyceroglycolipids are metabolites of some marine algae. They are located on the cell surface membranes, together with glycoprotein and glycosaminoglycans, and form the glycocalyx membrane. They play a fundamental role in multiple cellular function as a signal transduction and have various biological properties such as antioxidant and anti-inflammatory and antiviral properties and minimum, making involved this kind of enzyme. Several microbiome communities have been identified in therapeutic peloid that contribute both to the elimination to the toxic substances and to the antibacterial properties. Is enough documentary. In addition, several studies show that the continued use of peloid is perfectly suitable for therapeutic use. We can use every time. And to finish, we present this study by our Estonian colleague, Barge Tulik. I think we are seeing by internet, where he studied a method to assess the therapeutic efficacy of peloid to the electrical bioimpedance. It's very interesting study, and we need to stay in alert. That's all. Thank you for your attention.
Very much, Professor Carbajo. A work that frames perfectly with the logo of the Congress, 47th Congress, that is evidence-based balneology. Now let me introduce Professor Carpentier, who will present one of his works, the scientific evidence for balneotherapy treatment in patients with chronic
Yeah, I know it.
Mr. President, ladies and gentlemen, first of all, I would like to tell how happy I am to be in front of you, and I would like to thank very much Professor Noz, Constantin Munteanu, who organized this nice congress in this very beautiful place, and give me the opportunity to speak about one topic which is close to my heart in addition to that. So I am professor of vascular medicine and very much interested in the fate of these patients with chronic venous insufficiency, and later we'll speak about lymphedema, who are suffering from a chronic condition, and there is not much done for them. They are undertreated. What is the most important is rehabilitation, and spa therapy can do a lot for them. I would like to explain you and to convince you that this is important and should be improved and increased. So in France, nowadays, there are almost 100,000 people going to a spa resort every year for phlebology in one of these 14 resorts. You can think they are reimbursed for their care, not for everything else. And you see, this is a format which is always the same, 3 weeks, 6 days a week, 4 to 6 sessions a day. You could think that 100,000 patients, it's a lot, but in fact, it is not. When you compare that to the population, 67 million people in France, and the prevalence of these chronic venous disorders. Of course, varicose veins and venous symptoms are very widespread in the general population, close to 50%. But even the most severe cases, those who deserve to have rehabilitation, when the skin is damaged with pigmentation, induration, and at the end of the story, the leg ulcers, even those smaller group is 5%, which for the country like ours, it is 3.5 million people. So these are a lot of people suffering from a condition which leads to venous ulcers. And you can see also that it is more than 400,000 people who suffer from a new ulcer every year in a country like France. They will have 6 months treatment, very costly. It's a painful condition, disabling, and this is very costly for the health system. Now, only, as you can see, a small proportion of varicose veins people will go to the skin damage and deserve rehabilitation. But because we can treat early the varicose vein efficiently now with ambulatory treatment. But when it is too late, you have to make the rehabilitation, and this is the only thing we can do for them, and it is efficient, I will show you. But also, the other half of those people with severe venous disease had a thrombosis, venous thrombosis, and there's a sequelae of this thrombosis, the post-thrombotic syndrome, and those are damage of the deep veins, and we cannot do much for them at the moment. So this is only the rehabilitation, which means first the compression therapy and walking, but then more adapted programs. The targets of the Balneology venous rehabilitation, the most important one is to improve the calf muscle venous pump. The venous system is passive, and what is activating it is the locomotor system. This is why also combination of rheumatology and venous rehabilitation is important. So you know certainly that the muscle can change its volume when contracting. So when you relax, you decrease the pressure in the subfascia compartment. This allows the blood to flow in the veins. And then when there is an increase in the contracting muscles, then you have the pressure is increased and the blood is ejected in the vein system towards the earth. So we need for that to have locomotion, we need to have activity, and we need to have a good trophicity of the muscles. So all these elements are the targets of the venous rehabilitation as it is done with balneotherapy. In addition to that, we try to improve the accessory venous pumps, which is the good functioning of the plantar pump and also the most efficient, more efficient functioning of the diaphragm with a good respiratory system. So these, when you look to what are these patients and what is the prognosis factors, there are additional factors which are clearly related to the behavior, the health-related behaviors of the patient. Obesity and overweight is the most risk factor in addition to a bad venous system. The inadequate compression therapy is not easy to handle every day, and inadequate compression therapy is for sure a poor prognosis factor. Limitation of the ankle movement. The ankle is important for the muscles of the legs, of course, to work properly. And in the venous disease, you have hardening of the skin and limitation of the ankle movement, which is a consequence of the severe disease, venous disease, but also a factor of worsening of the disease. And then, of course, the lack of activity and the occupation leading to sitting, prolonged sitting or still standing is a prognosis factor. So in addition to what we can do for a better functioning of the veins through rehabilitation, there is also a need for education and to change and to improve the health behaviors of the patient regarding all these factors. Now, what we do in the spa resorts specialized in venous disease is, first of all, the cares dedicated to improve special targets regarding these dysfunctions of the veins. The most important care is the walking pool, because the people are in the water under pressure, which is good for the system. When you have 70 centimeters of water, it is the same as to have 2 layers of grade 3 stockings, which is a lot. They walk, and this is, of course, good at the moment, but it is also good for increasing the trophicity of their muscles. They do that 10 or 15 minutes every day during 3 weeks, and this is really increasing their strength for these muscles. They also have other cares, 4 to 6 per day, as I said, but I don't have time to detail all that. But all of them have a specific target trying to improve one pathophysiological mechanism in order to improve the situation. This is to show, just for understanding, that when you are in the water, 70 centimeters lower than the limit with the air, you have a decrease due to the pressure of approximately half of the diameter of the veins, which of course makes a 4 times decrease in the circumference. And this leads to the fact that you can have a very important improvement of the flow, of the speed at least, of the velocity of the blood in the veins. Here you can see, of course, you know that it is possible to make therapeutic education for the patient in the spa resorts, because we have a lot of patients with the same condition, because there is the logistic is facilitated there. They are motivated for their health. They are facilitating positive environment. And in addition to that, which is important, at least for the venous patient, that what they know, what they learn in the workshops, for example, regarding the importance of how to walk and to make it regular and to put the foot right as it is, as to be on the floor and so on, they will use that to make a better training, walking pool activity, which make the rehabilitation better. And at the same time, when they have this message about how it is important to walk, how it is important to have the pressure and to put their garment when they have to do it and so on. And in this case, when they will revise this message during 10 minutes every day during 3 weeks, they will never forget. So the cares themselves have an educational input, which is really interesting for a better motivation for the patient. And therefore, we developed, thanks to AFRET in France, a national program for educating these patients. It's dedicated to the format we have in the SPA results. So it has to be done in 3 weeks. And after that, we contact the patient for further phone or video discussions. These programs are with face-to-face interviews and workshops. And as I said, they take into account that they are the care, which are an additional interesting component. And just briefly, the first 149 patients, we measured what was the efficiency. And you can see that looking to how they were able to change their behaviors when they leave the results, they have to decide 1, 2, or 3 objectives. And approximately they achieve, it is not here, they achieve 60% of their objective, and almost none of them had no improvement in their behavior 3 months after leaving the SPA results. So it is really strongly efficient for changing the behavior of the patient on the long term or medium term. Look, okay. Now I would like to summarize very briefly what we know about the efficacy of this SPA resort treatment for the venous patients, most of them with education. And with this specific organization of 3 weeks, always the same, we were able to have a randomized control study in the same format, 3 of them in France, and is homogeneous. And all of them showed a very important efficacy regarding not only the pain and the quality of life, but indeed the state of the skin. All of them have very severe cases with damage of the skin, and the skin was improved that we could measure with scores, as in the multi-center study, or with measuring directly the pigmentation of the skin. And this was of long duration. I will only give some details about the most important one, which was again promoted by AFRET, which is, as you can see, designed as randomized, and both groups have the treatment, the SPA treatment, but one at the beginning of the studies after randomization, and the other one 1 year later. So the treated group has the immediate treatment, and the control group has the delayed treatment, and we compare what occurs during the first year. In this kind of disease, many patients would like to participate, but we only selected those who are the most severe cases, and we selected 400 ones who had very few. We have very few dropouts. The group were quite comparable between the 2 groups. I just show you that they are really severe, and half of them have had a history of DVT, and half of them almost also a previous ulcer, so they are indeed very severe cases. And when you look to the results, what we measured was positively improved. On the kinetics of the effect, you can see very well on the first part on the left. You can see the pain is improving immediately, and you can see that 12 months after the treatment, the SPA treatment, the difference remains highly significant. After 1 year, the second group makes the treatment and balneology treatment, and then the improvement occurred, but 1 year later than the first group, of course. There's some improvement of the clinical skin score, VCSS, the venous quality of life, the general quality of life, also health-related quality of life was improved. The only one thing that was not really improved was the incidence of leg ulcers, because we were not able to detect the difference. We didn't have enough power to detect it. There are also other randomized control trials that were performed in other countries. The format is a bit different, so we cannot combine them very easily with the other ones. But they showed positive results as well. The way they were treated was less many, a smaller amount of cares during 2 weeks or 3 weeks, and mainly walking pool, but not additional things, and not, well, it is going back, and not education mostly. But they showed positive effects, at least on the quality of life, and one about VCSS. The last one from Medicati and all from Italy is interesting because they measured some pathophysiological measurements of such as the volumetry of the leg, just the functioning of the ankle, which I said is important, and so on, and showed the improvement of this particular measurement, which explain a bit of why the patients are going better. It is really because they have an improvement of the physiology of the venous return. So in conclusion, for the patient with chronic resistant insufficiency, the treatment as it is done in the SPA results is associating a balneotherapy rehabilitation with active care, the most important of which is the walking pool, and it is targeted on improving the cough venous pump function and other additional pumps. And most often we have also, and this is an opportunity for the patient, to add specific therapeutic indication in order to make the patient follow the good exercises learned to do in the SPA results and to be more compliant to their other treatments. So the efficacy of the 3-week format as it is performed in France was really proven by 3 consistent randomized control studies with very consistent results, and in the most severe patients with this condition. And this study showed that not only it is important, efficient on a statistical point of view, but the magnitude of the improvement is high, and the duration at least for 1 year. So indeed, this is something that we have to promote in order to treat many patients. Thank you for your attention.
Now, now we continue with Patrick Carpentier. Patrick Carpentier, all the people read, can read paper from Patrick Carpentier. In my opinion, he's make a very lovely thing for the balneology. He is specialized in clinical study, and in this moment, it's very important to know the efficacy of the balneology, and here we have it, one of the leaders of this item. And for that, Patrick Carpentier have the second intervention with the title Balneotherapy for the Patient with Lymphedema. Thank you very much.
Thank you for your kind words. I have to say that I am in vascular medicine, and the other specialists need to have this kind of proof in order to be convinced. If not, they don't know what is occurring in these SPA results, who are far from their office, and so they need to read papers as it is done for the drugs and so on. Unfortunately, we have to go through that in order to convince them. Now, I would like to speak about another kind of vascular disease, chronic, which is also in France allowed to be treated in the phlebological accredited spa resorts. This is lymphedema, and the lymphedema is certainly chronic. It is even more disabling probably than the most severe cases of venous disease. It is less prevalent. It is a rare disease, but at least 100,000 people in France. And indeed, those people are very disabled, and they feel that the medical doctors and the health system don't take care of them. So there is a need for, and they are really willing to have better support from for the medical community. So it is defined as a chronic progressive swelling of any limb, but it can be also elsewhere, but most often the limbs, and which is what I will speak about. With edema first, and then skin fibrosis, and all that is related to lymphatic dysfunctions. It is not every kind of edema. What is the most known is the primary case, which are sometimes congenital, but can occur 1 or 2 decades later. But the most widespread part of this lymphedema are the secondary lymphedema. And nowadays, it is mainly related to the surgery and radiotherapy after cancer treatment, and especially the upper limb lymphedema after breast cancer treatment. The quality of life is altered because of this swelling, which make limb difficult to handle, any movement, and also disequilibrium and further functional problems with the spine, the joints, and so on. Because there are recurrent infections which can be severe, like erysipelas, which is, in fact, as you know, a septicemia. And what is really important for them too is that this change in their body appearance is difficult to live, especially when it is a permanent reminder of your previous cancer and things like that. It is this condition people need psychological support, or almost all of them. And to adapt for that, the only thing we can do, which is efficient, is a compressive treatment, high compression, difficult to put on, and also it shows for the people you live with and so on. So this treatment is not well supported by the patient as well, and the compliance is not always as it should be. When you look to the guidelines at what should be done in this patient, these are the last one, which were the best one, and by the national group of Dutch rehabilitation, which are really interested in this condition. What is striking is that almost all that what is recommended is done by rehabilitation only. And the other thing that is striking is that the patient himself has to do a lot. And in fact, if he learns what he has to do, there are many things that he could be by himself and get autonomy and not being always supported by the kinesiotherapist. Now, the French, there are so 14 resorts in France able to allow to take this patient, but only 4 of them developed a specific program. And I will show you how it works and where we are. So for the lower limbs, the venous rehabilitation is the cares, the balneotherapy cares are okay. and walking is important. Of course, the massages are really important, and they are done especially in order to improve the fibrosis. But the regular care that are done for the venous patients can apply to those patients. It is not the same for the upper limbs, of course, and so there are attempts to improve the tangential showers and things like that, trying to make some massages using the water, and there are several. This is the first prototype. There are 3 or 4 generations now, but there is a lot to be improved yet for this kind of care. But at least there is a triumph to improve that. And what is really very important, more important even than in the venous patients, with this patient with lymphedema, is to educate them. Because as I said, there is a lot they can do. And if they don't do anything, even not wearing their stockings, they will worsen for sure and rapidly. So this is really one condition where education is important, very important. So we had a program derived from the previous one, but with more activities. The structure is the same. It is made during the spa treatment of 3 weeks. There are 3 educational workshops regarding their knowledge and what they should avoid and what to do in order to not to get the complication, especially the infections. But in addition to that, they have also practical workshops, making them able to make their own bandages, the small bandage of the fingers and the toes and all of that. It is not easy to do, but they can do it when they learn. They learn also to make auto massage, which is not lymphatic drainage, but it is something they can do in order to smoothen the points where there is resistance and so on. We teach them how to do. Of course, they will have to do that under the supervision of the physiotherapist afterwards, but they can do it every day by themselves. So this is the program, and of course, they will be followed by phone or physio 3 and 9 months later. When we organize this kind of program, and when it is authorized by the NIH, I would say the NHS, the ARS in France, we have to have an evaluation. So they have a built-in evaluation. I'll show you how it is. Of course, it is only observational, but I think it is already really interesting. So each patient entering this kind of program always has this measurement you can see on the slide. They have a measurement of the lymph nodes by circumference measurements before and at the end of the spa stay. They have measurement of health behavior because they choose improvement of their behavior objectives, and then we measure if they get to that or if they fail. And of course, we try to make them try again. We measure the discomfort. In this case, it was a simple Likert scale, and the quality of life using the UKI 5D. And then that's all. The first patient, this is in one resort only, where I have all the data in small results. And you can see the results in the 186 patients. This is, you can see that most of them are women. Women are more prevalent than men, but the disproportion is not that much important in the general population. You can see also that most of them were with secondary lymphedema, and that they had 50-50 repartition between the upper and lower limbs. And then when you can see what occurred at the end of this treatment, first of all, when they finish their stay at the spa resort after 18 days of balneotherapy, you can see here the reduction in the lymph volume, which is seen in whatever lymph was damaged by the lymphedema. And approximately it is 5% reduction. Not 5% reduction of the lymphedema, but 5% reduction of the lymph, which is a lot. And when you look to 3 months later, what they were able to achieve, it is a bit less striking that for the venous patient, because their objective were more difficult to achieve. But you see that they at 2/3 were able to achieve fully at least one objective, and that 4% only, 7 people in fact in the old cohort, didn't make any progress in their behavior after leaving the spa resort. And then what we measure about health through the phone 3 months later, which is not, it is only a marker, it's not a proof, but you can see that when measuring their discomfort, you can see a significant decrease. And when looking to the EQ5D, you have an improvement of the quality of life. So this is really very much encouraging, and therefore, right now, there is under the umbrella of AFRET again, I will never say thank you enough for that. We have a randomized control study ongoing, trying to assess scientifically and to prove what we have seen in the court. And with that, I have finished my 2 presentations. Thank you very much for your kind attention.
We continue with Davide Rossi. The new parameters for assessment of peloids using contact angle method.
Thank you. Thank you very much at all. Thank you very much to President Monteanu for the invitation, and thank you very much to all of present. The surface tensiometry research applied to peloids in the organ thermal area was based on a particular liquids pertaining to the family of FAS. The FAS are a particular liquid that can be divided in 3 main groups: the PFAS and PFA precursor, for example, perfluoroalkyl acids, and perfluoroalkyl acid precursor, for example, perfluoroalkyl ethers. Other FAS that can be represented by perfluoroalkanes, perfluorinated aromatics, perfluoroalkyl ethers, and perfluoroalkyl amines. And the polymeric FAS that are divided in 2 kinds of categories: the perfluoropolyethers, PFPA, and the perfluoropolymers, PTFA. The polyperfluoromethyl isopropyl ether is the only biocompatible perfluoropolyethers actually in commerce. So this particularly perfluoropolymethyl isopropyl ether is biocompatible because many investigations confirmed no acute toxicity at limit dosage, no limit dosage and no acute thermal toxicity, no blood residues, and not irritant for dermal and ocular irritation, no delayed contact hypersensibility, and no comedogenic and no mutagenic. But why this kind of perfluoropolyether is biocompatible? This because PFPA is hydrophobicity, has a lipophobicity, and is self-repellent. The main characteristic of PFPA is the high contain on fluorine, 68% in the molecule. And this make the CF bond very strong, stable, and non-reactive. So the perfluoropolyether applied to the study of peloids in organic thermal area was a study in measurement of the static contact angle on the peloids and, excuse me, what's happened? Is it disappeared? Oh, excuse me, something's on. So the perfluoropolyether applied to study of peloids consent to determine the energy surface of the Mars through the measurements of the static contact angle method. And the marker is developed based on this kind of measure is going automatically. Excuse me, but it's going. I don't touch it. Okay, because it's automatically going. That's there. Okay, thank you. Okay, and a second possibility is to determine the surface free energy, the dispersion component, polar component of pelloids using the same static contact angle method. And a third possibility is to determine the biological maturation process of pelloids. I don't know. And using the kinetic contact angle method, measuring the contact angle of perfluoropolyether over the time. Generally, in Euganian thermal area, the number of mud therapies performed in a kind of spas start in May and reach its maximum level at June and decrease toward the end of the season. And the season end in Italy in the spas in November. So we try to correlate the static contact angle, the contact angle of perfluoropolyether measured using static contact angle method, and we correlated the contact angle of perfluoropolyether measured over time using the kinetic contact angle method. It was possible to correlate the static contact angle of perfluoropolyether to the maximum of mud therapies performed in the month of June. And this because the contact angles of perfluoropolyethers represented by the TOS mud index fall inside of a specific acceptability range. This specific acceptability range fall inside with the reference mud. The reference mud or the reference Euganian thermal mass is a type represented typical pelloids having typical chemical, mineralogical, rheological, surface energy properties, and maturation degree. This research was also performed in the single spas and collecting the pelloids from different maturation plant. In this case, maturation plant was representative by manual pulse plant and silos plant or automatic plants for maturation process of the pelloids. And the contact angle of perfluoropolyether demonstrated that it was a high variability in the data. That means there was a high variability on the maturation process of the pelloids collected from this kind of plants. In particular, in this case, in the spas N3, take demonstrate to be needs to be more comparable with the number of mud therapies performed in month of June. Oh, what's happened? Okay, the contact angle of perfluoropolyethers can be converted in surface free energy of pelloids using particular mathematical models. The surface free energy of a pelloid is composed by the dispersion component and the polar component. The dispersion component from a surface tensiometer point is represented by the organic compounds present in the mud in that moment of the analysis. And the polar component is represented the inorganic and more polar component present in the mud in that moment. So the dispersion component can be subdivided in two kinds of it. The basal dispersion component of thermal muds or pelloids that is related to the organic compound present at the beginning of the maturation process, particularly for example, in the virgin mud. The dispersion component due to the maturation process is the dispersion component that is present after the maturation process during the seasonality of the spas. So we developed the first new parameter that called the surface tensiometry parameter that represented the ratio between the dispersed component of the organic compounds and the polar component of the thermal mud from a surface tensiometry viewpoint. Comparing the data of dispersion component with the seasonality and the number of mud therapy performed during the season, we have noticed that we demonstrated that there is an interconnection between the number of mud therapies in June respect to the month of May in the start and the dispersion component that increased during the maturation process. So the second parameter was developed using the kinetic contact angle method, measuring the contact angle of perforated polyether over the time. The contact angle of perforated polyether over the time can be expressed and be visualized using the power function trend line. Okay, and this data is and the contact angle and the new parameters, the second new parameters that we developed using this kind of method was interconnect with the area obtained from the difference between the epsilon values for each point of a trend line of the virgin mud and that values obtained from the pelloids collected in May, in June, and in September. The only things is that this new parameter that called the surface tensiometry thermal mud parameter, the second one, has demonstrated to not well discriminate and not well comparable with the seasonality for June and for September. For this reason, in order to increase the discriminating capability of the method, we try to develop a assessment method based on the intercept values of each trend lines integrated with the correlation degree, R2. Integrating these two parameters, it was possible to give a first assessment of a maturation degree of thermal mass. For example, a low maturation degree of thermal mass of the pelloids was detected during the period of May and in the virgin mud. And this is normal because the virgin mud and the month of May during the start of the season are at the beginning. So the pelloids are not enriched by substances during the maturation process. Differently, in June and September, the values of intercepts decrease and the value of the correlation degree increase. And this consent us to give assessment of very good maturation degree of the pelloids. In order to better define the difference and better compare the seasonality of the spas with the maturation degree of the mud, we developed a third parameters called maturation process intensity. This was important because it was based on the spinning drop speed of the liquid drop of perforated polyether during the time, and was measured in the two range a first range from 1 counts to 31 counts, and a second range from 31 counts and 61 counts. And so it was possible to obtain a parameter that better discriminate the situation from June to September. That was a problem with the parameter before. Okay, comparing now the maturation process intensity measured in the first range, 1 to 31, with the maturation process index measured in the second range, 31-61, it was possible to correlate with the max value of maturation process, of maturation therapies performed in June, due to the high difference high difference between them. Okay, in month of June, the difference between the two measurements in the two range are bigger than the other month, and this confirms that there is really a connection between the seasonality of the thermal spas with the surface tensiometry parameters. As the same, it was performed the same method investigated on investigated on the single maturation plants inside of the thermal spas, and it was possible to demonstrate that the manual plant demonstrate a very higher maturation process intensity. This because the peloids from the manual plant doesn't reach in June a good maturation process. So the intensity of the work is very high respect to other plants that are more adequate for the period. So if correlating the data of the dispersion component from the maturation process and the deviation standard of the data of this drop speed of polyethers were possible in also to confirm that the month of June is really the month in which is possible to have the maximum maturation degrees of the pellet collected. Naturally, we also check the correlation between the correlation coefficient of the power function used for determination of the maturation process intensity and the dispersion component due to the maturation process, and for many other kind of samples, different spas and different plants inside of each spas. And also in this case, the maximum correlation between the correlation degree of the function and the dispersed component of the MAD reach its maximum in June. So summarizing, the maturation degree of pelloids can be assessed using static contact angle method and kinetic contact angle method through the elaboration of the surface tensiometry parameter and the develop of the other parameter that is a maturation process index. The two index is compose the MAD maturation index. The final. In conclusion, the polyperform methyl isopropyl ether is the only biocompatible FAS for industrial use actually in commerce and destructible by incineration. The perfluoropolyether is a hydrophobic, lipophobic, and self-repellent liquid test, applied for the first time in surface tensiometry, applied to the thermalies to evaluate the quality of pelloids and their maturation steps. The contact angle is not influenced by surface roughness friction forces generated interface with pelloids and proved to be very sensitive in detection of chemical physical modification in pelloids in relation to the spring water. The new parameters, surface tensiometry parameter and maturation process intensity, derived respectively from static and kinetic contact angle methodologies, are so useful for our scope. These two new parameters demonstrate the strong link between the amount of dispersion component, organic component due to the maturation process of the mud, and the behavior biological maturation process, making them measurable in fast and non-invasive way. So in perspectives, surface tensiometry can be a non-invasive and rapid tool for determining the quality of a pelloid in relation to the type of spring water in which the maturation process perform. STP and MPI could be an asset for the fast evaluation of pelloids in relation to the quality of spring water. Thank you very much. And this is in honor of my professor, in remembrance of Professor Paolo Manzini, scientist, generous volunteer in social activities and a great friend.
Time only for 2 questions, maybe, if something, if one, yeah.
David, congratulations for this presentation. It's difficult for me because I'm not an expert. You know that is Dr. Legido who is the expert on that. But I think you open a new way of studying pelloids in terms of maturation. So this could be used for not only for seasonal maturation, but also for the normal maturation. For example, in other countries, start maturation could be three months ago, 6 months ago, and when the pelloid is ready, they apply. It's a bit different. So could be a good way of studying the maturation process and determine which is the optimus stage. Yeah, thank you.
Surface tensiometry applied to the assessment of maturation degree of thermal mass can be applied in every circumstances. It's not only for, this is only a presentation that put in evidence that during the maximum activity of spas, the thermal mass should be reached a great maturation degree, the maximum maturation degree as possible. But surface tensiometry is generally applicable to every other context in thermalism. And so also, for example, to qualify the real performance of a maturation plant. As you see, different maturation plants have different contact angle value. And this is important because some maturation plants don't work properly. So if a maturation plant don't work properly, it's possible that the mud is not matured in the moment of the maximum activity of the spa. Hoping that responds correctly to your question.
Short question I have also for Professor Carbajo. In case of rats on the skin or something like that, I don't know if in Romanian is negi, domn profesor, sau veruci. Veruci sau negi, în engleză cred că este vraț. Da, words. So in this case, how it is possible to use the mud or mud applications? Have some knowledge about this kind of thank you.
I discard this possibility because you are the clinical study. impossible, impossible is nothing like, it's very rare that you have some possibility of damage to the skin. But there are all kind of passion. At the end, you found people who have all the problems. And for this question, you need to avoid the steroid and put corticosteroid or INE free. But the question is to know the knowledge of the peloid and know the pH is very important. Know the capacity of irritation. Make back tests from and repeat back tests too. You have some security. It's impossible to have some skin reaction. That contact dermatitis is the real name, but that is possible. You need to retire and put an anti-inflammatory cream or pill.
Thank you. We are closing the ceremony and we warmly invite you, everybody, in front of the sanatorium to make the group picture of the Congress. Thank you.
So please come in the front of the sanatorium right now to have a general photo of the Congress. Thank you so much.
to start on the turn time.